How's it going, guys? Welcome to Mike's Health Hacks. Tonight, I want to talk a little bit about the benefits of vitamin B12, specifically during this situation that we're all in. Vitamin B12 is an essential vitamin, it's water soluble. When a vitamin is classified as essential, it means that the body doesn't produce it on its own. So we must consume it through our diet, and that's the only way we can absorb vitamin B12. When we talk about the food groups that are high in B12, specifically, we'd be talking about lean meats, poultry, and dairy products. What happens is the recommended daily income for an adult is 2.4 micrograms per day. In certain cases, like in pregnant women, we may require a little bit more. Now, during times like this, everyone's during in a situation that no one planned out. It's stressful, it's taking a toll on our body and our mind. So we can increase these doses and we can consume more through supplements, either oral tablets or intramuscular injections. Now, when it comes to our two main groups or two main topics that I'd like to talk about today is B12 and mental health and the immune system. That's specifically important for these times right now during a pandemic. So I'm going to concentrate mainly on those two. Now, when it comes to mental health, B12 is fundamental because it facilitates the conversion of amino acids into hormones and neurotransmitters. It's required for the production of monoamine neurotransmitters such as serotonin and catecholamines like dopamine. Now, when we talk about serotonin, interestingly enough, serotonin is actually known as the happy molecule, or, what people say, the feel-good chemical. Recent studies have shown that B12 increases serotonin, and not only that, but it increases dopamine. Now, dopamine is interesting because dopamine acts as a hormone in the body, and in the brain, it acts like a neurotransmitter. So what is interesting about all of this is that serotonin in general, if you have low levels of serotonin, you will be considered to be finding yourself in a depressive state. Now, even normal healthy adults can be in these depressive states or these states that you would say, mood swings or just basically not being yourself. And that's perfectly normal. During stressful times like this, I don't think anybody was, anticipating such an event. So our body tends to stress out a little bit more than what it's used to. So B12 deficiencies in general or low levels can cause certain symptoms like fatigue, confusion, agitation. It could even cause poor concentration. Now, if we would go even lower and we talk about now a B12 deficiency has already been known to be cause of actually even psychiatric symptoms. It can cause acute psychosis, it can cause severe anxiety, and even in some cases hallucination. Now, when we talk about risk factors of B12 deficiencies, the number one thing we need to take into factor is age. As we get older, our GI tract absorbs less and less vitamin B12. So if we absorb less B12, we're more predisposed to having these type of symptoms or actually even developing a B12 deficiency. Now, it's not just age. There's also healthy adults and young adults and older people that consume certain pharmaceutical drugs like metformin. Metformin is actually a very common drug used to treat diabetes. And it doesn't matter what age you are, but if you consume metformin, you tend to have a deficiency in B12. So if you take metformin, you're going to require a supplemental B12. And not only that, but one interesting thing I like to talk about is vegans and strict vegetarians. Since the majority of B12 come from animal products, if you're a strict vegan or a strict vegetarian, you're going to want to supplement with B12. So in the case of mental health, if it increases serotonin, increases dopamine, it tends to stabilize the mood. You help yourself feel better, you're more motivated, you're more energetic. Since dopamine is part of the reward system, like when you get a good grade on an exam that you get happy, that's a dopamine rush that you feel there. Serotonin is more of a general thing. When you have low levels and you're constantly with low levels, you're going to feel depressed. You're going to know you're depressed, and not even anything that you can do will change that. So basically just increasing both of these neurotransmitters, B12 is actually very important during these times where the mind has taken added stress that we don't need. And It's actually very simple, very cheap, and very easy to use, and it has very good benefits. Now, when we talk about the immune system is obviously like the army for your body, and it protects your cells, it protects your organs, it protects everything. Now, when we talk about vitamin B12, it has a vital function in specifically two cells. Obviously, within your immune system, we're talking about white blood cells, but we're talking about lymphocytes and we're talking about NK cells. Now, when we talk about lymphocytes, we're talking about specifically the CD8, which are known as cytotoxic. The cytotoxic cells, actually known as killer cells, but they're based on specific antigen receptors, meaning in order for the cytotoxic cells to actually kill a virus or another infected cell, they must bind with their antigen receptor to this infected cell and then kill it. When we talk about the NK cells are known as natural killer cells, meaning they can actually kill without having to bind through antigen receptors because they don't have antigen receptors. The natural killer cells can kill any type of infected cells. So B12 has been known to increase the function of both these cells. And if we increase both of these cells, we're actually having a stronger immune system that's quicker to respond, more efficient, and can actually prevent illnesses from the common flu to viral infections and much more. So basically, just taking into consideration these two simple things that vitamin B12 does on the mental health and the immune system makes it one of the most important vitamins you should be consuming during this COVID-19 pandemic. Obviously, I'm not an advocate of it curing it, or I'm not saying go ahead and start injecting every day. My common thing is I usually consume 1,000 micrograms per month through an intramuscular injection. Obviously, during these times, I'm consuming a little higher. I'm taking a weekly shot of 1,000 micrograms. If you can't get your hands on injections, well, you can take supplemental oral tablets. You can find it in Walgreens and CVS or any pharmacy in the United States. Out here in Costa Rica, intramuscular injections are actually very cheap and they're found in any pharmacy. So if you're traveling abroad, which I doubt anyone is right now, you can also consume it through intramuscular injections. It is more beneficial if you take it through an intramuscular injection than oral tablets, but it's better to consume extra supplementation than none. Now, in general, vitamin B12 doesn't cause any side effects. As of right now, there is no toxicity level established because the majority of excess B12 that you consume, whether it's from diet or supplements, it's excreted through your kidneys. So this doesn't have overdose, this doesn't have these crazy side effects that most people talk about. Although a lot of these things are myths, there are some risks and they're mild side effects. There are some people that present mild diarrhea, there's some people that present nausea, vomiting. Although in my personal experience, I have not had a single side effect, nor any of the patients I recommend this to. It's so important to take that into consideration. Now, there are some people that I do not recommend using this, and that's usually a group of people that are very, very small population, meaning certain patients that have blood abnormalities, patients that have allergy, obviously, to B12, or even in cases of people who have just undergone a procedure of an implantation of a stent in a coronary artery. What happens is vitamin B12, besides those two main functions of mental health and immune system, it also has a benefit in producing hemoglobin and red blood cells. So when procedures are done like stents, actually you want to be anticoagulated, and the increase in red blood cells actually makes your blood denser. And it has been known that it can actually obstruct a common stent that has just been placed. So if you're in those risk groups, I don't recommend it. If you have no allergies, if you don't have any blood abnormalities or have gone through any procedures recently, then you are perfectly eligible to taking this vitamin, and you will have many benefits in doing so. If you liked this video or if you found it interesting, please subscribe. If you would like to know about any topic, you can write below in the comments. I always read all the comments, and I'll be checking out more videos, and I'll be posting weekly videos. And have a good night.